Yeah, I'm a third generation physician. My father and grandfather were primary care physicians. My father also practiced emergency medicine, and they owned their own clinical practices. And because they owned their own clinical practices, they had complete control over their healthcare businesses and therefore had autonomy over the way they practiced clinical medicine. I finished my radiology residency in 2004 here in Dallas at UT Southwestern in Parkland. And I was very intentional. I wanted to find a practice that would provide me the autonomy and the ownership that my father and grandfather had. So I joined a small group, rural location east of Dallas. For the first 5 years, very happy, with the situation. And the senior partners, did start to retire from, the clinical practice, but they retained their ownership and management and leadership of the group, both the radiology group and the imaging centers that we subcontracted for. And the first few years were good, but over time, the managing partners and the management style of the practice changed from more from a clinical perspective to more a business perspective. Eventually, in 2020, I decided I wanted to do something different, and so I decided to work with a career coach and kind of explore different opportunities. And I joined a healthcare startup accelerator here in Dallas called Health Walkouters, and I've been working with them for almost 5 years now. And then I also took on a role as the director of the diagnostic imaging program for an independent utilization management company. Kind of the end of 2020 and beginning of 2021, the founder of Healthcare Shares reached out to me to invest in his first startup company. And I was interested, but when he told me about his concept for healthcare shares, I was, much more interested in that as it aligned with my, beliefs and interests in physician and clinician and healthcare worker entrepreneurship and ownership. And so I, explained I was definitely interested. Over the next 2 years, we talked, and then in 2022, he started forming the company, and I joined in September of 2022. We launched or started, offering digital marketing services to clients in 2023, and we've been doing that for a little bit over 18 months. Our clients have had success in raising capital, and they've raised over $5 million now. And in addition to the financial success that they've had, there's a lot of non-financial benefits to raising capital directly from angel investors rather than going through venture capital groups, including the marketing campaigns are also targeted at clients and customers, and physicians and healthcare executives that could be members of their executive leadership team or their medical advisory board, or help them with introductions to people to obtain pilot programs, things like that. Just basically assisting them with the development and growth of their companies. And several of our clients have had these non-financial successes as well. About 6 months ago, we launched a venture fund in order to invest in the healthcare startups, not only our clients, but other companies. And we've been recruiting investors and advisors for that. We have over 150 members for our investor and advisory board now. We've invested in the first few companies. And in addition to that, we have a community on the Circle platform that's designed, for social impact. We launched that in the spring of 2024. And then in the future, we plan to launch an accelerator program and a venture studio. The accelerator program will be designed for physician entrepreneurs, both practicing physicians, but also physicians in training, so medical students and residents. It's an accelerator program that is accommodating and supportive of physicians in clinical practice. So most accelerator programs and other investment organizations in the healthcare startup space and startup space in general, they require full-time entrepreneurs, which obviously for physicians, they would either have to leave, clinical practice, or if it's a resident or a student, they would have to, have a pause, a stop if their program allowed that. And so this accelerator program would be designed to be accommodating to their schedules and allow them to continue the clinical practice and support them in building out, their companies. And so in the venture studio is kind of a more extreme example of that. The venture studio, an example of how that would work is a physician or a medical student or a resident may come to the company and say, "Hey, I have this idea, but I just want to, be involved, but I'm not the one, to build the company." And so the venture studio would co-found the company with them, build out the executive leadership team, the medical advisory board, raise capital, and basically be involved all the way from, conceptualization through commercialization and exit. And what I really like about, that approach is it really mirrors the long-term trusted patient-physician relationship within medicine to investing in the healthcare startups. The social impact community is designed for anyone that's interested in advocacy, whether they're interested in the investment advisor mentor roles or not. And so for sure, many of the people that are involved with healthcare shares are going to be in both groups, but some are going to be really just interested in the advocacy part. And then some are just going to be interested in the investment and advisor part. And we're definitely looking not only for investors and mentors and advisors to join our board, and then also advocates to join our social impact community. But we're also looking for, founders, whether they're physician or, clinicians, or even if they're non-clinical, but they're in that healthcare space and they really perceive the value and the benefit of a community of physician and healthcare executive angel investors that want to support them. So, as I mentioned, we're trying to build an ecosystem, and we're trying to. I mean, obviously, we can't build it, by ourselves, and we, strongly value that the community, and so we're trying to grow that community as large as possible to support that.
Hey, Dan, we just have a few more minutes, so I'd love to hear from you. What ask for what you need. What do you need perhaps from the community? And then offer what you can. What are you offering?
What we offer is digital marketing and advertising to healthcare startups and their entrepreneurs so that they can raise capital directly from angel investors rather than going through venture capital groups, or are looking to, find and market to clients and customers, or, individuals that could be part of their, leadership team, their medical advisory board. So we definitely need clients. We need founders, that want to help co-found their companies and to bring, their ideas, to reality. And then we need obviously investors to be able to invest in the companies that we're looking at, and mentors and advisors to help with our own advisory board, but then also to help our individual clients, the healthcare startups themselves. They're going to need their own advisory boards. And the opportunities and what we offer really go hand in hand with the needs, because a lot of the people in the healthcare startup world, they're looking for, companies and entrepreneurs to mentor and to advise and to work with, and, maybe eventually as the company grows to be part of the team. And a lot of the people that I meet, whether they're, physician or clinician or non-clinical, they want to give back. They want to be involved, with companies that want to have a positive social impact on healthcare. And, that's definitely the type of community and ecosystem, that we're trying to build.
That's excellent. So you touched on it slightly, but I wonder if you can elaborate. The first time you and I talked, I really felt like the solution that Healthcare Shares was offering was geared towards physicians. What is your ideal individual who would look to Healthcare Shares?
The accelerator program itself is more physician-centered and physician-focused. And I would say the reason for that is, I mean, we're really trying to differentiate ourselves from, the traditional, venture capital investment world, how it's restrictive, to full-time entrepreneurs, and it's not as supportive, and doesn't even, necessarily take into account, the clinicians and the physicians' perspectives while they're building the company. I mean, obviously, when they build it to, a certain size, they have to bring in, physician and clinician expertise. But a lot of times that's done, kind of late in the process. And you think about all of the ideas that, could come from physicians if they're involved from the very beginning,
Mm,
of the venture, how
mm.
different things would look. And compared to once the product is delivered to the physicians and they're trying to figure out, well, this is a really interesting product, but how do I integrate this into my clinical practice? So when we're thinking about, investing in companies or founding companies or, bringing them in as clients, we're always taking the perspective of how is this going to be, utilized by the physicians? How is this going to make, their day easier, not more burdensome.